So look, every parent knows what it's like to stay up most of the night with your child when they have a fever and the illness and all of that happens, and it seems to get worse at night. Is it our imagination? I don't think so. Dr. JJ is going to take us through this. No, it's not, is it?
No, judging by the tens of thousands of phone calls I got over the night over the last 30 years. Certainly not only do kids get worse, but the poor parents, your anxiety and your fear gets worse at night. And that's because of a simple hormone that we all make in our body in abundance in the day, which is called cortisol. And at night, our normal cortisol levels fall to almost zero. Cortisol is responsible for a number of things. It suppresses fever, it's anti-inflammatory, so it helps with pain, and it also helps us deal with stress. And so when we are stressed, cortisol helps us during the day, and we can manage problem solving so much better in the day than we can at night. So I think cortisol really is sort of the multitasker that when it drops out at night, all things go bad.
Okay, well, we might lose our way, but what about the fever? Because fevers go up at night.
Yeah.
Yes.
So.
Why is that?
So let's make a distinction between temperature, body temperature, and fever. So our body temperature typically is around 98.6. The older you get, actually, it drops a little lower. But over the course of the day, we're breathing, our heart is beating, and we have muscle work. And so your body needs to get rid of the heat from even heartbeats and even from breathing by raising the body temperature so that you can off-gas it by radiating heat and sweating. So at the end of the day, when our cortisol levels are around 6 o'clock, they're pretty low, we are also exuding much more heat. So our temperature naturally goes up by about a degree. So think about a child at 99.6 or close to 100 as a normal body temperature at night.
Yeah.
Then add a virus or add a strep throat or some other illness, and then your base temperature is 100 now, and you add 3 more degrees to that, and of course it makes you wild-eyed as a parent. It makes everybody worried, and there's so much folklore around fever anyway that that's when the calls start rolling in, usually around 9, 10 o'clock at night when the cortisol is lowest.
Right. Should you try to do something to keep your cortisol levels up so that doesn't happen?
You know, you can't. This is your body's natural biorhythm, and if you can imagine in the cave dwellers' days, this is when you hunted and you needed your stress hormones. This is when you went back in your cave and you didn't need them.
Yeah.
So in evolution, it's thought that this is why we have these biorhythms.
What about coughing? You know, like I noticed that if I've got a cough, when I go to bed, it's even worse and you can't sleep. And then, do you know what I'm
Kids are the same way.
And that's even adults, you know, like.
No, it's true. And I think that there are some positional things that happen at night. Okay, there's that we're laying in bed, and so our postnasal drip, we don't swallow it unconsciously like we do during the day, so it collects and ruminates in the back of our throat, tickles our cough center. But again, the anti-inflammatory effects of cortisol are lost at night, and so an irritated cough gets even worse.
So how do we help our children with the discomfort of a cold or fever?
Okay, so with fever, the key thing is that if your child is functioning, if they're eating and drinking and playing, fever can be our friend to a point. It really is the body's way of sort of frying a bacteria or a virus. And contrary to popular belief, especially growing up in my heyday, parents were so afraid that fever was going to fry our brains or cause us to have horrible things happen, when in fact it is our friend and it's a result of our body really fighting off an illness. That said, if you have a child who has a fever, no matter what the degree, who's laying down on the couch, is listless, refuses to eat, drink, or play, of course you want to alleviate their discomfort. And under those circumstances, you want to give a fever relief medicine. Now, the caveat to that is that on the jar of the fever relief medicine are doses based on child's ages.
It's hard to tell.
Not on weight. And actually, so many parents underdose their kids because the effective doses of fever relief are weight-based. They're not age-based, because we have a broad swath of kids at all ages. Yeah, so the key thing is that, at every well child visit, for all of you out there, when you are talking to your doctor and you're leaving your well visit, ask what the current dose of ibuprofen or acetaminophen is for your child, and that definitely will be something that you can record on a notepad in your fridge. Yeah.
We just went through this with Ava not long ago, but what degree temperature, like at what point is it now dangerous and I need to bring them to the hospital or just stay at home and medicate them?
The degree of fever that is worrisome is that which stops your child in their tracks, okay? So that could be 102, it could be 105.
Where they're all
It's really about functionally what they are able to do, if they're able to hold down fluids. And so the key thing when your kid does have a high fever, tons of cool fluids. And unlike back in the day when they would douse kids in rubbing alcohol and throw them into ice baths, what you want to do is put your child in a warm bath or warm shower, not a tepid one. You don't want goosebumps to form to drive to heat in and the temperature up. You want your child to be a lobster and radiate heat. So a nice warm bath is usually a couple degrees cooler than your child.
Okay.
Yeah.
Put them in
I
there,
just
let
gotta
them
say, if
play.
my kid had 105 fever, I'm calling my doctor. I'm sorry,
Yeah.
that's a little bit too
Yeah,
high
Ava
for
just
me.
had
I'm
104.
panicked with that.
Yeah.
All right, well, we want to thank him for your helpful advice as always, and your information from Dr. J.J. Levinstein. You can go to drjj.com and our own website as well. We're
All
going
right,
to go to our
we're
show.
coming back. Shirley, you're up.